Everyone, in this video we are going to discuss about yet another important topic for NEET PG exam, that is febrile seizure. Febrile seizure. The name itself has febrile in it, right? That means the seizure is associated with fever. It is the most common seizure disorder that is encountered in children. It is hypothesized that in the developing brain, in the growing child, in fever there are different interleukins that are released, and in response to that interleukins there is excitation of the brain parenchyma. Right? As the child grows, no longer there is such activity. Right? So this febrile seizure would be seen in the developing child. To label it as a febrile seizure, we have a criteria. Let us look down into the criteria for this febrile seizure. The age of the child should be in between 6 months to 5 years, a developing child, right? And there should be fever, that is temperature more than 38 degrees Celsius or more than 100.4 degree Fahrenheit, right? And also we have to exclude other diagnoses that can cause both seizure and fever. So we will exclude other diagnoses like meningitis, encephalitis, right? The child should be neurologically normal. The child should be neurologically normal, right? And lastly, there should not be any history of previous afebrile seizure. Afebrile seizure. So this constitutes the criteria for febrile seizure. The age should be in between 6 months to 5 years. Temperature more than 38 degrees Celsius or more than 100.4 degree Fahrenheit. The child should be neurologically normal, and there should not be any history of previous afebrile seizure. Now, a child with febrile seizure can present to me in two categories. One is the simple febrile seizure, where the prognosis is going to be good and the seizure is less likely to recur in future. Whereas the other variety is the complex febrile seizure, where the recurrence rate is high and the prognosis is going to be bad, right? That's why we need to know these two types of febrile seizure. So let us start with the types of febrile seizure. Febrile seizure can be a simple febrile seizure. It can be a simple febrile seizure, or it can be a complex febrile seizure. Simple febrile seizure is the one where the type of seizure that happens is generalized tonic-clonic seizure. The duration of the seizure is going to be less than 15 minutes. Right? And the seizure will not recur within 24 hours. Within 24 hours. Right? This type of seizures, we know the prognosis is going to be good, and these seizures do not recur. There are less chances of recurrence in future. Less chances. Right? On the other hand, if the seizure is focal, we label it as a complex seizure. Or if the duration of the seizure is more than 15 minutes, we label it as a complex febrile seizure. Or if the seizure recur within 24 hours, we label it as complex seizure. The prognosis here is going to be poor and the rate of recurrence is high. Right? Now the important point here to note is, to label it as a complex febrile seizure, I need either of these criteria. If the seizure is focal but less than 15 minutes, it's complex. If the seizure is generalized tonic-clonic seizure but the duration is more than 15 minutes, it's going to be complex. If there is generalized tonic-clonic seizure less than 5 minutes or 15 minutes and they recur within 24 hours, I again label it as complex febrile seizure. But for simple febrile seizures to happen, all the three criteria should be met. It should be a generalized seizures less than 15 minutes duration and should not recur within 24 hours. Right? It is important for us to know the criteria and the definitions here of type of febrile seizure, because the diagnosis of febrile seizure is made purely by history and examination. So let's talk about the diagnosis here. It is a clinical diagnosis. We make it by history and examination. Right? Apart from that, investigations Investigations are seldom done. We do investigations only in the high risk group children. High risk group children. What are these high risk group children? These are the children that have complex febrile seizure, children who have a family history of epilepsy, or children that have some form of neurodevelopmental delay. So in this high risk group children, we will need to investigate. Otherwise, no need of any investigation. It is a clinical diagnosis. You only need history and examination, right? Now you have made the diagnosis of febrile seizure. Now coming down to the management of febrile seizure. When we talk about the management of febrile seizure, the management here is three-pronged. Firstly, the child is presenting to you with seizure. You need to control that seizure, abort that seizure. So the first prong here is going to be seizure control. I know the seizure is happening because of the fever. So second is fever control, that is antipyretic therapy. And lastly, we don't want the seizure to recur with fever. So we need some prophylaxis as well. Right? So the management here is divided into three parts: seizure control, antipyretic therapy, and lastly prophylaxis, so that these febrile seizures do not recur in future with fever. Right? Seizure control, we all know. We keep the child in the left lateral position, recovery position, and give intranasal midazolam. If the child is in emergency, you can stabilize the child A, B, C, give oxygen and insert a cannula and give benzodiazepines, right? So seizure control primarily involves administration of benzodiazepine or intranasal midazolam. Antipyretic therapy involves giving paracetamol, simple paracetamol to bring down the temperature. And lastly, coming down to prophylaxis. Prophylaxis could be intermittent prophylaxis or it could be continuous prophylaxis. Intermittent prophylaxis, the name itself says intermittent. That means we give antiepileptic for a small duration of time and then stop it. Again, we give it for a small duration of time, then stop it. This therapy is intermittent, right? This intermittent prophylaxis is given in children where the age at onset of febrile seizure is less than 18 months. Second, where there is a family history of febrile seizure. And lastly, when we have frequent seizures, frequent febrile seizures, that is more than 3 episodes in 6 months or more than 4 episodes in 12 months. In all these patients, we are going to give prophylaxis, intermittent prophylaxis. In intermittent prophylaxis, we give oral clobazam or diazepam. We give tablet clobazam for 3 days, starting from the day of fever, starting from day 1 of fever. Right? So this covers intermittent prophylaxis. Now coming to the continuous prophylaxis. In continuous prophylaxis, I will give daily antiepileptic therapy. We give daily valproate till 2 years of seizure-free period. Where we are going to give this daily therapy, continuous prophylaxis, in children where there is complex febrile seizure, which are frequent complex febrile seizure, that is more than 3 in 6 months or more than 4 in 12 months. Children that have febrile status epilepticus, that is febrile seizure lasting for more than 30 minutes. And lastly, in children with some neurodevelopmental deficit or delay. So this covers the topic of febrile seizure. We need to know the types of febrile seizure. We need to know the definition of febrile seizure. We need to know the diagnosis, how to make a diagnosis, and lastly management. That includes seizure control, antipyretic therapy, and prophylaxis, intermittent and continuous prophylaxis. Thank you.